but it's still on book. So if a physician tells you that a person can't have dental work because their platelets are too low, the physician is over the dentist, which is why you should always, if you are, if you're in doubt, if you're in doubt that your patient has been on bisphosphonates and you want to take out a tooth, you ask the physician to write a letter that clears you, that absolves you, because here in Texas, the dentist is under a physician. Medical clearance. You can call it whatever you want. Okay. But we want to have our documentation there. So here's what happens. Physician tells the dentist, wow, your PSA is 760. PSA is not supposed to be over 4. It's a prostate specific antigen. So this person not only has cancer in the prostate, but it's everywhere, absolutely everywhere. So the physician, who is one that knows about the tooth body connection, tells the person, I will not see you again for any follow-up visits until you have your root canal tooth taken out. So he goes to see a dentist and he says, my physician won't see me anymore until you take this tooth out. And so the dentist said, I feel like you're here under duress. It doesn't sound like you want the tooth out. And I don't want to participate in that because the standard of care in dentistry is that we would save your tooth at all costs. Maybe you need to go see a root canal specialist and have it retreated. No. The doctor was adamant that tooth needs to come out. And he said, I'm sorry. If you wanted the tooth taken out and you came in and you understood why you wanted the tooth taken out, I would be in a place to want to help you, but not the way you worded it. So he leaves. He goes back to his dentist that did the root canal, and the dentist is offended. There's nothing wrong with my root canal. There's nothing wrong at all. Why would he want the root canal taken out? It's a perfectly healthy root canal. That's just ridiculous. So he marches the patient across the hall to an endodontist, which is a specialist that only does root canals. Do you see anything wrong with the root canal? So he looks at the x-ray. No, I don't see anything wrong with it. See, there's nothing wrong with this. I tell you what, if you can find anybody who'll take this root canal tooth taken out, I'll turn them into the board. It's just ridiculous. This is a perfectly healthy root canal. So he goes back to his physician and says, I can't find anybody who will take the tooth out. They say it's healthy. Well, that's hogwash. Get out of my office. I don't want to see you. You are not allowed to come in here and have treatment until that tooth is gone. It's interfering with my ability to get your body to heal because it's disconnecting the part of the body that I need to get energy to. Bye-bye. Get out of here. So the guy leaves and he goes back to the dentist that wouldn't take out the tooth because of the way he worded it. And he comes back in and says, I will sign whatever you want. I'm begging. Please take this tooth out. Please take it out. I don't want the tooth. Please take the tooth out. I need to survive. Take the tooth out. Okay, so they get paperwork signed. The tooth gets taken out. It gets sent off for pathology. Pathology report comes back that the materials had gone beyond the end of the apex and it has set up a secondary infection because of a foreign body. So basically, the gutta percha squirted out the end and set up an infection in the root tail. The board gets involved. A letter comes from the board. How in the world did the board find out about it? The daughter of the man who was set up to get a nice inheritance as her daddy died, now that her daddy is not dead because the root canal tooth was taken out and the treatments that the physician was trying to do before are now working, she goes to the dentist who said it was a perfectly healthy root canal and he would turn anybody into the board, and she said, let's do it. Is that not crazy? So 2 years after the tooth was taken out, the man is still alive, and he's talking to the Texas State Board saying, I'm not even the one turning the dentist in. I'm very grateful I'm still here. It's my daughter that is upset because she doesn't have her inheritance. And it's this other dentist who's upset because he thinks he did a root canal. That is good. But in actuality, if you look at the pathology report, the material went beyond the end of the apex, which he could not see in his defense. Do you know what happened? Now, you'd think hearing all that information, the board would go, oh, that's a terrible story, and I'm so happy that you're still alive and that you have a flipper in its place. Instead, what they said is, do you know in your reports where you took out this tooth, you had the patient on nitrous and you didn't document the percent of nitrous to oxygen? $5,000 fine, and there's board action against you. It is not the odd things that you do that will get you in trouble. It is the things that you're supposed to do, like documentation, that you are delegating to someone else, and it is your license. If that person doesn't document something as simple as that, you're going to end up in a lot of hot water. And trust me, I served 2 terms on the Texas State Board. Of course, working as a paramedic, we were always called into court. And you don't get called into court for something that happened a week ago. And I already told you my memory is not the best. It's usually something that's like 4 or 5 years ago, and you're trying to read through your report going, what did I mean by that? Pupils blown. Well, I guess they shot themselves in the head. Usually pupils blown mean that they're enlarged, but I don't even think he had eyeballs there. So I think I wrote that as in pupils blown out of the head. But if you don't document exactly, and in a court of law, they tear you a new one and make you look like an idiot. So do the best you can when you're documenting. And I mean that from the standpoint of, if you're doing surgery, let's say, does anybody do cavitation surgery here? You want to write the time, what the blood pressure was before the procedure was started, how many carpioles of anesthetic were given, what kind of anesthetic was given, where was the incision made, from where to where, how long was it? When you get to the cavitation, how long was it? How deep was it? How wide was it? Was there black oily exudate? Was there fatty tissue? Did you send it off to a path lab? All of that needs to be documented. Is that person a smoker? Because that's going to change the outcome of their cavitation or not. So documentation, and we do a whole course on documentation. Mike Margolis is really good about doing that. And if I can get this to work, we'll have more of these where y'all can just go online and watch them. That's the advantage to being a member of the IABDM, is that you get to watch our little videos and stuff at no charge. Here's Dr. Boland, and again, he wrote books, which if you're a member of the IABDM, his books are on our website. So you have access to go in there and download them, or whatever you call it, upload it to be able to read page by page on there and learn all about EAV. EAV is repeatable. It is not biofeedback. Biofeedback on something like a Zyto might tell me, oh man, you're not in Zen right now. And yeah, there's a tooth that's causing you a problem. But then 5 minutes later, I'll put my hand on there. Oh, now you're in Zen. Really? I still have the same root canal tooth that's abscessed. How can I be in Zen? Whereas when you're doing EAV, it's repeatable. You do it each time and it's repeatable. Already told you the second temperature. Yes, I do expect you to believe it. When you're holding on to the bar with EAV, it's connected to a battery. So I've got electricity going through the hand, going through the finger, touching a tooth, and I'm vacuuming out on that circuit. I know how much electricity I'm putting in. I know how much I should get out. If I don't get a good number, I have to try to figure out why. So I'm looking at the patterns that are in there, trying to find something that will balance it. So I could actually have a tooth that is painful because of a thyroid. Vice versa, I might have a tooth that's painful because it's already started the process of dying. If you're going to do a crown on that tooth, wouldn't you like to know that the tooth is starting to die so that you could tell the patient, I already have information that the prognosis on this tooth is guarded and I'm going to put it in a temporary. We're going to try some homeopathic remedies. And if it seems to improve, then we will consider having you spending money for a permanent crown, versus let's just put it on and then the patient thinks you did it and that you killed the tooth. And that is what will come out of their mouth, is that the tooth was fine until Dr. So-and-so got in touch with it, but now they killed the tooth. Did you have a question?
So it shows energy blockages on the radian?
Oh yeah. Oh yeah, it's amazing. Okay, so the equipment will show some results. It also shows an indicator drop. So it lets me know if we're stealing electricity in a particular area and where the biggest burden is. Another test that you could use would be muscle testing. I had to learn muscle testing in school. I've taken more muscle testing classes, but in my own mind, I feel like I can put myself into the equation. If I know that the person has an abscess on a particular tooth, I feel like I can push harder or not push harder. And therefore, I just like the EAV better because I can take myself out of the equation. And for me, it's more fair. But I have seen people be so good at muscle testing that they can tell you what your blood sugar is and test you with the glucometer, and it's spot on, exact. It's just that most people that do muscle testing, they don't have a clue. They don't know to check to see whether the person is flipped or not. They're pushing a particular kind of vitamin. They learned how to do it from somebody else who learned how to do it, and therefore they just go, "Yep, this is good for you," and they don't have any other information. All the way down to iodine. Iodine is pretty safe to take, but if you give me iodine because I have Hashimoto's, my thyroid will completely shut off, and my TSH will go as high as 97, and it shouldn't be over 4. I have a wig to prove it because I went a whole year with very little hair because someone got the bright idea I should take iodine orally. It is, everything has its issues and everybody's body is unique. Okay, so resources for 8K and EAV, if you can learn them on the website. Sometimes we have classes for them. We had Dr. Amora come in and teach us O-ring testing, which is really pretty cool too. And then we're going to talk about thermography for just a second. Okay, so when I do thermography, did you have a question about the other?
So about EAV testing, it's so hard for, how do you incorporate EAV in a dental office if not in having one provider in a city?
Okay, usually it's not in the dental office. There are some things that you can do in the dental office, like compatibility of dental materials or using it during surgery. So like during surgery, if you touch an area and there's still dead bone, you won't get a perfect reading. Once you scoop out all the dead bone, it's a perfect reading no matter what you do. It's just perfect, perfect, perfect. If you're getting to the point where you're doing like I'm doing, where I'm going through and spending about an hour, it's honestly better to have someone who's connected outside of the office, because if you could sit in and listen to the things that I tell the person, I prepare them, I educate them about things that then they go in and they tell the dentist, I want these 3 teeth taken out. It's not, well, I don't know, I have root canals there, and what do you think? Should I have them taken out? Not, will I be healthier if I take them out? I'm so sick. Do you really think it'll make a difference? And those people are in a different place. They normally walk in and they demand, this is what I want. Based on what I've already had testing wise and talking to Don, this is what I want. How much is it going to cost in order to get me there?
Can we clone you?
Yeah, well, we had an EAV class. I've got a couple people who went through the EAV class. The unfortunate thing is, it takes about 18 months to learn how to do EAV. And so when you can find somebody who does EAV, you need to to that person. Be so nice to them, because they could just leave in a heartbeat and go someplace else and take all their toys and go with them. But yeah, a lot of people will send down here just for the test results, even if in Austin. We've got people that come down to Austin just for results, and then they go back and get all their stuff done there. Okay, so now we're in thermography. So thermography is just a camera. It's a heat-seeking camera. It deals with colors. Where it's white, it's the hottest, and then it goes to red, orange, yellow, green, blue, and black. No matter where you take a picture, it doesn't matter if you take a picture of a hand or a head or a breast or whatever, but I take pictures of the head, the neck, the breast, the back, and under the arms. So think about this. Everybody except you has probably had a mammogram done at least once in their life. You tell me you've had a mammogram done. You and I are going to have a conversation later. But when you walk up to the equipment, well, you might not, you're too young. You walk up to a mammogram equipment, you raise your arm up, which lifts the breast up slightly, and you rest your breast on a metal plate. Another metal plate comes down like a vice grip. Okay, but when I do that on my breast right now, I have breast tissue right here. It's not under the plate. So I guess they just magically absolve it. Okay, bless that tissue over there because it doesn't fit under the plate. We're sure it's okay. No, they don't check it. And you know, some of these really large women that come in, they've got breast tissue that goes all the way to the back, because when I take pictures of their back, they got boobs on their back. And when I had breast implants, I swore one morning I was going to wake up with one on the back and one on the front, and I was going to look lopsided. It's a true story. Somewhere in 1990, I looked like a man. I was working on the ambulance. I looked like a man with 2 B bites. I have pictures of me in dicky pants, which are police officers' pants with that wide belt, and I have no shirt on. I'm at the plastic surgeon's office. And I had my picture taken, and you cannot tell it's not a man. I weighed 90 pounds at the time, so I was skinny, but I didn't have anything. Hadn't had any children, had never been pregnant, so I just had nothing but bee bites. I decided to get implants done, but okay, I don't seemingly have any problems. I get pregnant. Well, first off, I get married. Then I get pregnant. Then I have somewhere, or I was going to school in Washington, D.C. for my integrative medicine, and they did some type of testing on me, and they said, you have a problem with this breast. What kind of problem? No, you need to go get checked out. You got a problem over here. You need to go get a mammogram, an ultrasound, and I'm like, what? Okay, so I go in and I do a mammogram. And I have a mammogram done on this one. I have one done on this one. They come back out and they said, this one didn't really capture very well, so we're going to do this again. Go ahead and put your arm up. Let's do it again. So they clamp down a little bit harder, hurts a little bit more. Come back out. Now we still ain't going to get a good image. We're going to do it again. And I'm going, no, wait a minute. Isn't this a lot of radiation? I mean, I know in dentistry we take X-rays a lot, but isn't this a whole lot more? If you've taken it twice and you hadn't gotten it, maybe you need to send somebody else in that knows what they're doing. If we've got to at least take it again. So someone else comes in. They clamp down so hard, I am crying, and I'm not trickle trying. I am boohoo crying, and not nice words are coming out of my mouth. You did not want to be near where I was. And when they let it up, my entire arm goes numb. Well, now I'm really crying. Okay, you guys have messed me up. I can't feel my arm. It's numb. So they run me over, and they go do an MRI at my expense. I didn't do it. They did it. But you sign release forms. If they do anything wrong to you, it's not their fault. It's all your fault. I don't know what I did, but it was my fault. So I had to pay for this. Then I had to go see another doctor who said, they pinched a nerve. Don't worry about it. It could take up to 6 months for it to completely heal, but just don't worry about it. Nothing's wrong. And I'm going, well, are you sure they didn't rupture the implant? Are you sure? Okay, we're going to go do a conical MRI, which is kind of like, who's the lady that had the cones? Not Janet Jackson, but Madonna, yeah. But you're laying down and you stick your boobs in these cones and they do an MRI, making sure that they can see all of the implant. No, it hadn't ruptured. But from that moment on, it was always painful. I couldn't lay on my left side to sleep at night. When I would hug people, I would hug people this way. So I did that until about 2.5 years ago. And 2.5 years ago, I just decided, you're supposed to have them taken out every 10 years. For those of you that have breast implants, maybe they didn't do that, but you are supposed to have them replaced every 10 years. Somehow I didn't want to be in a nursing home at 75 years old. Miss Young, it's time for you to have your boobs re-put back in. And so I just decided I was going to have them taken out and have the lift done. And just be as flat as whatever. When we are doing thermography, we have the advantage of being able to see under the side, which you cannot see in a mammogram. Now, a mammogram is a screening device. It does not tell you you have cancer. I didn't know that. I thought you had a mammogram and it told you whether you had cancer or not. And most of my patients, when they come in, they didn't have a clue that it's a screening device. What does that mean? It means that if they find like a little calcification or something, then they'll want to do further investigation. You mean it doesn't tell me if I have cancer? No, it doesn't. Now, thermography is another screening device. It doesn't tell you that it has cancer. Nothing short of having that cell looked at under a microscope will tell you if that cell is cancer. It will tell you there's inflammation in an area. So we get more information than just about your breast. We get to find out about your thyroid. We get to find about your carotid arteries. We get to find out about an airway, which is really cool. So when I have a patient and I turn them from the side and they are like this, that's somebody that has an airway problem because they are positioning themselves to try to open the airway to get more breath. So I tell them right away, you need to see a dentist that does a DNA appliance or a Vivos because you have an airway problem. What? That's what they just told me. It's $7,000. Oh my God, I know, but they can fix what is wrong with you. Yes.
So the other thing with the thermograph is a lot of the, pictures show, hotspot in this area.
It does, but it does not tell you if it's a cavitation or a root canal. I'm going to use my.
Due to grinding?
It can be due to grinding. It can be due, if I don't have makeup on, you will see that above my lip is blue because both my mom and I have blood vessels that are closer to the surface. So if we don't have makeup on and you see us, you'll say, you eat something blueberry? Because you got blueberry up on your lip. No, it's just the blood vessel is closer to the surface. I have paresthesia from here to here because of a cavitation surgery where my wisdom tooth was taken out, okay? And so it images slightly different on one side from the other. So I'm gonna give you a little bit of information here. There isn't a good or a bad. Sometimes we want it to be warmer and other times we want it to be cooler. Do you see these hands? You see the ones on top? That is someone with Raynaud's. They have horrible circulation to their hands. You see the ones down on the bottom where they have red spots? That's someone with pre-arthritis or carpal tunnel. So if I'm using thermography and we look at this x-ray, you can see this x-ray and obviously you can see pathology, right? Everybody can see pathology at the root tip of that tooth. Now you look at the intraoral camera, what do you see on the side? An abscess. So you would expect that this area would show up warmer because there's infection. So you would expect that it wouldn't be like blue. You would expect it would be orange or red. Here is a person, sadly, she went to see a biological dentist in Austin. Can you see the x-ray down on the bottom? This person had a ton of implants done, some root canals done. This is a biological dentist who does root canals. Somehow that's an oxymoron. Just don't understand how that happens. Do you see the red that is going on here? That's where all the root canals and the implant are. And if I could show you her breast, which she didn't allow me to do that, that red line goes all the way down to her breast. She's been diagnosed with stage 4 breast cancer. Since then, she's passed away. Now you look at this one. Yeah.
What is your take on zirconia implants?
Oh, we're going to get to implants. You're not going to like my explanation on that too. But write that one down because that's another one we want to make sure that you all hear before at the end of today. So you look at the very first picture, which is right over here, right? It's the full face. And you see that she's got some sinus stuff going on. Do you see that it is more red on what is her left side than on her right side? So she's got more inflammation in the sinus on the left side than she does on the right side. In thermography, we want everything to look the same on one side as it does on the other. Okay, in the second picture, she's turning this way, so you're seeing the right side of her face. Do you see any red? But then she turns this way. Do you see red? Mm-hmm. Now you look at the x-ray. Where's the root canal? Where the red is. Correct. It doesn't always do this, but a lot of times it does. And that particular tooth is going right up into the maxillary sinus and causing all this inflammation up in here as well. This is what we would love to see at every time that we do this. But a lot of times, because the root canal teeth are dead or it's a cavitation that's avascular, it images colder. And that's very confusing for the physician reading the report because these are all MDs that are either oncologists, radiologists, OBGYN. So I am the only person feeding them information. So before I started feeding them information, they didn't even know that teeth were on certain meridians. Now they have this long report that they write back and they go, this is tooth number 14, which has to do with the breast and the spleen and the thyroid and the stomach. You need to have a dentist check this out. It could cause a secondary infection. And I'm like, oh my God, look what one little person can do. And this is the report that I did on here. So it's hard for you to see, but on tooth number 14, it shows up with kiefer which means that it's dead. It's a root canal tooth. It's been taxidermied. Of course it's dead. And it affects the thyroid and the left breast. Then if I look at some of the other teeth, it shows that tooth number 21 is an issue because of tooth number 14. So tooth number 14 is on the same meridian. It's causing a problem. And then I've got 2 teeth down on the bottom front where the adrenals are affecting the tooth. Can you fix somebody's adrenals as a dentist? No. You're gonna have to send them someplace. What could it be? It could be an MTHFR flaw, could be they're low in magnesium, low in B12, could be that they have food allergies, it could be that their cortisol levels are off, it could be blood sugar swings. That is outside of your scope. You've got to network with somebody in order to fix this person. And then on tooth number 31, it says mercury, lung, and large intestine. Well, there is a mercury filling there, and you, as a dentist, can remove the mercury filling safely. But then somebody is going to have to do chelation on that individual in order to get the mercury out of those 2 tissues, the lung and large intestine. And then I have a note down here. It says, should have toxic metal hair and urine challenge done, which we'll get to later because I know somebody asked me a question. Homeopathy, when we're talking about different dilutions of things, the one thing that I want you to know today, I would love for you guys to come to the homeopathy course so that I can really get you to understand homeopathy and you feel very comfortable with it. But I have a homeopathic remedy, that I'm going to pass around for you guys to see. And I'm going to give you the shortest explanation that I can possibly give about homeopathy. Pretend I'm a 400-pound motorboat in the water going 40 miles an hour. Can you envision I'm creating a wake behind my boat? If a 400-pound boat coming the exact opposite direction was going the same speed, when we pass each other, the wakes will cancel each other out and there will be clear water. Does everybody understand that? My husband understands it in radio static because he used to be a DJ on a radio. I don't understand that at all. It doesn't make any sense to me. In homeopathy, like cures like. So on the ambulance, coolest thing ever, we go to somebody's house, their kid ingested something I call poison control, and poison control says induce vomiting right away. Cool. I've got Ipecac on the ambulance. It's cherry flavored. Get the little kid to drink the Ipecac. Now they're supposed to try to drink something afterwards. What kid will drink, 18 or so ounces of water? They won't. So I always would carry a can of Coke on the ambulance and say, here, drink as much Coke as you possibly can, which is even cooler because when it finally connects, you're going to stick this kid in the shower and close the shower curtain because it's projectile vomiting. And with the Coke, it foams. So it's just going all over the wall, foam all over the place. But then I can just turn on the shower everything down, pick up the kid and take him with me to the hospital. Now, if you had nausea and vomiting and you could not stop the nausea and vomiting, you would take a homeopathic remedy of Ipecac. It's a very, very small dose of the same thing. So in homeopathy, like cures like. I can't explain it in a 5-minute session, which is why we're going to take several hours to go over it next month. But when a patient comes in and they have an x-ray taken, which is a necessary evil, you cannot do your job. These patients that come in and refuse x-rays, put your license on the line. They've not had x-rays in 2 years. I mean, basically, I would have to dismiss them. I'm sorry, I can't treat you. I can't. My license is on the line because if you leave and you've got decay, then I'm negligent. And so I'm not going to participate in supervised neglect. What I can offer you is a homeopathic remedy. We'll take the lowest amount of x-rays that we need to take, and I will offer you a homeopathic remedy which will neutralize the exposure of the radiation for today. X-rays in an office, whether it's a chest x-ray, that's not the only place you get x-ray. You fly in an airplane, you get a buttload of radiation. The skin of airplane does not prevent you from getting radiation. So I use this a lot for different things that I do. Take 3 little pellets. There's no magic number in 3. You can take 1 for all I care. The company wants you to take 5 because they would like to sell more. But 3 is a good number. You don't touch it with your fingers. Put 3 in the cap. Throw it under your tongue. Let it dissolve. You're good to go. Okay? So I'm just going to pass these around so that you can see them. Okay.
T symptoms like what?
Like cures like. You know, you have an allergy to ragweed, what they give you injections of? Okay, some of this is Marian stuff, so if somebody needs to have amalgams taken out, now I can't say in every biological office, but you should do this. I know in Dr. Glarus's office, I know in Teresa Scott's office, I know in Mike Margolis's office, I know there's several different doctors. If a patient comes in and they want their mercury fillings taken out, especially these sick patients, a lot of them are going to get sicker going through the process. So Dr. Glarus has a little thing on his that said, who are you working with to prepare your body for mercury removal? A lot of people, well, me included, if I'm doing something on the computer and it says, did you read everything and are you okay with it? Really, I'm not going to read it. I just check the box and go on because you can't get into the program unless you check yes. You know what I'm talking about? So a lot of people sign stuff and don't read it. The importance of preparing a person for mercury removal. Let's say, and this is one from Dr. Scott's office a couple of years ago, a lady that came in looks perfectly healthy. She didn't understand why she was having to jump through hoops, but she did. We did some blood work on her. Now, bilirubin shouldn't be over 1.2. It just shouldn't be. Hers came back 2.6, which means she cannot detoxify. So I gave her some things in order to try to help her liver to see if we could get it cleaned up. And 30 days later, we did another bilirubin, and it was 1.6. That's still not good enough. So we did it again, and we got it down below the 1.2. And I said, look, call the dentist office and have them move somebody off the schedule, because I don't know what kind of a window you have to be able to get this done. And that's exactly what they did. And then we found out later that she had Gilbert syndrome, which is just an issue where her bilirubin goes up and she has a hard time detoxifying. She didn't have a clue she even had it. A lot of these people are just not in a place that having their mercury fillings removed is the primary thing that needs to be done. Sometimes they have an MTHFR flaw they don't know they have, and so we want to make sure and get them on something for that methylation process. And it might not be methylcobalamin. They might have a COMT flaw as well, and might have to put them on the dental form, a hydroxy form. So because that is not what you're trained in, again, it's just better for you to network with someone who can prepare that person for mercury removal. Do you have to do that on every patient? I don't see why you would do it on every patient, but sometimes these people come in and they give you a health history that's this long, and you get nervous, and that is not the person you want to be taking chances on. So you just want to send them to somebody. Plus, you want to make sure that you know, everybody know about a Readometer or galvanic reaction. You want to take the most negative quadrant and work on that first. This is an example in there. And if you guys ever need stuff like this, if you just let me know, I can blow up the one slide and email it to you or whatever. But this is an example of the who are you working with. That just, yeah, write it down and email me. It absolves your office. I'll never forget the first time I lectured to a group of physicians. There were no dentists in the group whatsoever. And I heard from one of the physicians maybe a week or two later, he had had all his amalgams taken out because he was scared to death after listening to my lecture. Went to a friend that had it done and they didn't use any precautions whatsoever. And he could now no longer work. And so he was very frustrated. I said, but I did talk about safe mercury removal, but I didn't really drill it home enough. And I certainly didn't even talk about the prepping someone for mercury removal. So he just ran out and had it randomly done. So to prep the people, some ways some of the practitioners will do is looking at the excretory routes, your lymphatics, your lung, your large intestine, your liver, your kidneys, to see if it's all open, and then using drainage remedies in case you have to open it. The way I word it for a patient is, if we have if I give you a homework assignment, which is to go home and clean all the dust bunnies from under the bed, all the paper clips and everything, but while you're doing that, I am hammering the doors and windows closed. Well, now you didn't remove the trash that was in your room, you just moved it. And what we need is removal. Okay, so the other word picture I try to use is if you were sitting in a bathtub and the water's about to overflow and you call out through the door, Dawn, Dawn, the water's about to overflow. And I go, well, dummy, turn off the water faucet. That is getting your mercury fillings taken out. But you're still sitting in a bathtub full of water. Draining the water is the chelation process, which the dentist will have nothing to do with. So when you open up those excretory routes, for me, the way that I look at it is it's like a lint trap in a dryer. If I have a lint trap that's dirty and you're trying to get your towels to dry, the dryer is going through the motion, but the towels are not getting dry. When you use those homeopathics to keep those excretory routes open, it's like someone every once in a while stopping the dryer and pulling out the lint trap and cleaning it, putting it in the trash, and then putting it back in. What was your question?
So I've personally gone and spoken to so many providers in Dallas who are naturopaths, who are integrative providers, and I asked the same question: Do you know anything about heavy metal detox? And if I were to send my patients to you, just to understand, so that if I'm sending, I'm okay sending them their way. Everybody says yes. Everybody says they know, they do, but what is it I should be asking to make sure, I'm sending to someone like that?
Ask them to make sure that the bilirubin is okay. Ask them to make sure that they're not MTHFR. I mean, if they can't, pretty much I can look at labs, and if I see that the RDW is too high, if I see that the MCV is too high, those are two red flags for me that the person's MTHFR. I don't make them go through testing. What I do is just put them on something short term just to cover my butt. So I actually have a little sheet, and if you write it down and ask me when we go over there, I'll show you. But I actually have a little sheet for people that come in. Let's say the other day I had a lady that had flown in from Michigan, someplace, and she was seeing a dentist up the road, and she had not prepared for mercury removal. She had not done any blood work. She hadn't done squat. And yet, by the time she finished talking to me, then she got nervous. Oh my God, I'm about to have amalgams removed today. Have I screwed up? Well, I also don't want to make the dentist mad to lose an appointment. And this lady's already spent a fair amount of money on an air ticket and hotel. So yes, there are some things that you can do. I put them on lipospirit vitamin C. I put them on a drainage remedy. I put them on some coarse cilantro. And I put them on neuromethylation cream. So I just try to cover as many bases as possible. It's just not customized. So I don't know exactly what they need. So I just throw the book at them. Here. I mean, in worst case scenario, let's just cover all our bases. But that shouldn't be the job of the dentist. Because then they're going to say, oh, wait a minute. You're practicing medicine. You don't have that kind of a license.
And I don't want to do it. I don't want to get involved in it. I just want to make sure I'm sending them to the right.
Yeah, so those are some questions to ask. Do they use homeopathic remedies? Because like when kids come in, especially if they're autistic, then what I may use, there's a great company called HVS, Homeopathic Solutions. They're out of Florida. Everything they use is alcohol free. And you can put them on OS and support. And basically what that does is open every door and window in their body to allow their body to start detoxifying. It is not a detoxifier. And so you have to stress that to them. We're not pulling out heavy metals or parasites or anything else. All we're doing is cleaning lint traps.
What is it called? OS?
OS, and then there's another one called support that goes with it. I'll show you over there when we go next door. Okay, so we talked about that. All right, so let's show you some test results so that you've got some visual images in your mind. Here is a person who does a pre-DMPS, not DMSA, pre-DMPS. This is an unprovoked urine test. This person is going to collect 24 hours of urine. Every single time they pee for 24 hours, they're going to collect it, put it in a little thing, slosh it around at the end, and take a small sample. So where do you see the black square? It's way, way as far on the right as it can. Sorry, that's the left. On the left as it can be. So it makes it look like this person does not have a problem with mercury, correct?
Mm-hmm.
Now, the next test we're going to do is a provoked. This is the very same patient, but what we've done is given them a chelating agent. So the way I describe this to a patient is when we give you the chelating agent, it's like getting you to swallow a couple of guns, and all the guns go to different cells and say, this is stick up. You got heavy metals, dope it. And we collect our same urine and we find out what we have. What happened by simply giving this person DMPS? Wow, where did it go? It went from 0.5 up to 10. So this person does have mercury in their tissues, and it would be considered a mild exposure. After, look at the date on here. This is 896. Okay, now we're in January of 97, and this person has been going through IV chelation a couple times a week in order to try to get rid of the heavy metals. And now we're at 4.5. So, I mean, it is working, but it's not like it's just going to work overnight and be done. Okay, so what about a hair test? Well, a hair test is great for looking at heavy metals. It's great for screening for drugs. Sometimes you'll find mercury on there, sometimes you won't. Like I told you, Boyd Haley worked on all those little infants and didn't find any in their hair on the day that they were born. It just meant that they couldn't throw it out in their trash can. So the way I try to describe it is, think of this office filled with red apples, yellow apples, and green apples. And I have a trash can right here. I'm going to hire you, and all I want you to do is get rid of the green apples. I come back at the end of the day and I look at the trash can and I see 4 red apples, 2 green ones, and 6 yellow ones. Either you're colorblind and you have no idea what a green apple is, or somehow I did not communicate what I wanted you to do, because there are green and yellow and red apples all over the office still. It doesn't mean that you did a very good job, right? Versus I come back and I look in there and there's not one red apple, there's not one yellow apple, but it's filled to the brim with green apples. I might still have some green apples in the office, but you did a really good job throwing out green apples. You'll understand what I mean in just a second. This is the excretor. Look at this guy's hair test. This is his trash can. Do you see that the long line that's on top, which is mercury, is in the red? Can everybody see that on the screen? His little story is, he has 18 mercury fillings. He's completely healthy. He does not want his fillings taken out. His wife had 3 fillings taken out, and miraculously her chronic fatigue went away. So she's been on him like a chihuahua. Get your fillings taken out. Get your fillings taken out. That's all he hears all day long. So he goes to get his teeth cleaned at his dentist, and he said, my wife wants my fillings taken out and white ones put in. So the dentist looks around the mouth and says, they're all serviceable fillings. Why would I take them out? Because my wife wants them taken out? Are you going to be a mouth model? No. She got better health-wise. That's a bunk. You don't want to do that. I'm not taking them out. There's nothing wrong with them. He had told me he had never seen a physician in his life other than the day he was born. So when I got this test back, I did expect to see high levels of mercury, but I'm looking at it going, barium? Where'd you get that much barium? You're a liar. What? I said, you're a liar. I'm not. I said, you are too. You had either an upper or a lower GI with a barium swallow or a barium enema. Why would I have that? For an ulcer? Oh, when I was in law school, they thought I had an ulcer. I forgot. See, I told you that you're a liar. And a lawyer, now I know you're a liar. But okay. This is his hair test. So it lets us know that his body sees green apples and can throw them out. Is everybody on board with that? This is the same patient. I gave him DMSA orally and asked him to collect 6 hours worth of urine. What do you see in his body tissues? Now this is us walking through the house to see how many green apples are left. We got a bunch of green apples in the house. So it lets us know, yes, his mercury fillings, and I'm going to use this as an example. Let's take out a bicuspid with an occlusal, just an occlusal pit. I'm not talking about the whole thing. We just have a little, almost like snake eyes. I measure a Jerome mercury vapor sniffer over the top of that. That reading will be 0.06 micrograms per cubic meter or less. That doesn't mean anything to you because you don't know a number yet. If I told you that the government says it can be between 75 and 100, now you're going, well, 6/100 is nothing. Leave the guy be. 6/100 is nothing. But now I'm going to take that same tooth and I'm going to take a soft toothbrush and I'm going to brush over the top of that tooth twice. Who just brushes their teeth twice? Nobody I know. People get in there and they scrub, right? Okay, but for our sake, just twice. And now we test the reading with the drum worker vapor sniffer. That reading will be over 200. It went from 0.06 to 200 with the toothbrush. Now I'm going to take that tooth and I'm going to dip it in something hot like hot coffee. Over 200. Now I'm going to dip it in something cold that's acidic, iced tea, orange juice, lemonade, Coca-Cola, over 200. Do you get my point? That if you have a mercury filling in your mouth and you are choosing to brush your teeth, can't tell a patient not to, or you're choosing to eat or drink, that you're getting mercury off of this filling. That's just going to happen. It's how your body deals with it. Now, because this shows up in his urine test, but it also shows up in the hair test, it lets me know he's getting an exposure of mercury every day from those 18 fillings that he has. But his body recognizes, ooh, that's bad stuff. It's poo-poo. Let's throw it out in the hair. So we're going to call him an excreter. He could go to Mexico, get his fillings taken out wrong without any protocol whatsoever. And because his body is working as God intended, his body will start to clean up on its own. Everybody got that. It's not the smartest thing to do, but at least his body is working. Now, this is the hoarder. This lady comes in and tells me, I just got diagnosed with MS. Okay, so I looked at her blood work. Her serum alkaline phosphatase is actually better than mine, which sent up a red flag. So I asked her, who diagnosed you with having MS? A neurologist. Okay, well, he's got a license that I don't have, so I guess you have MS. But when we're looking at this, do you see in the hair test anything that's in the red? No, there's nothing that's in the red. She has 3 buccal pits. You know how small a buccal pit is? So I'm looking at this going, well, maybe it's because she only has 3 buccal pits. Maybe she doesn't have any heavy metals till I do the second part of the test. This is the same patient. What's in the red now that we've given her DMSA and forced it out of body tissues to see what kind of apples are in her house? She not only has green apples, she's got apples with worms in them. So let me try to make this so that you understand. The mercury and the lead are both high in this individual. Do you see that? Somebody's job somewhere is to take 100 rats in cages and give them a dose of something and watch to see how many rats die. They have to throw those 100 rats out because they can't give them an accumulative dose. They must give them the dose that when they give that dose, every time 50 of the rats die. That becomes the magic number, the LD50. You guys look at your MSDS sheets and you see that number, LD50. That's what it means. Yes. So the United States government says we take a mathematical equation of that LD50 and it becomes the LD1. We're bigger than rats. We should be able to handle more, but that LD1 is not enough to even kill 1 rat because it's a mathematical equation. But what if I told you if I give the LD1 of mercury and the LD1 of lead to the rats, 100% of the time, 100% of those rats are going to die. It's the most neurotoxic combination known to man. So now that you're looking at this, it's not just, oh crap, that's not good. Now she only has 3 mercury fillings. In her defense, she hasn't seen a dentist in quite some time, so she's got a lot of new decay. So she goes home and she talks to her husband and she calls me and she says, Dawn, I think my husband's going to let me see a special dentist. We've got dental insurance and he just wants me to go see the dentist that'll, take our insurance. And I said, oh, come back up here and let me explain to him again. I don't care about the new decay. The new decay, you can have composites dropped in. That's not my issue. I'm adamant about how you have those fillings taken out. So I explained to him, 0.06. So 200 using the toothbrush. What do you think is going to happen when a dentist takes a diamond drill and touches this? It's an invisible cloud of mercury vapor. Her body is stupid. Either she has an MTHFR flaw or she's low in glutathione. There's some reason why her body does not see mercury and know how to get it out. Have you ever heard of parents who make the claim, I took Johnny and Jeffrey to get their vaccinations, and Johnny is just fine, but Jeffrey won't look at me and he won't talk anymore? Okay, Jeffrey has a problem with the thimerosal in the vaccination. And he probably has an MTHFR flaw or is low in glutathione, therefore he can't process it out. So it's way more toxic for him than it is for John, whose body working. So I explained all that to her. I even have her sign a waiver that says that she understands those 3 fillings must be taken out by someone who knows what the heck they're doing. They go to church on Sunday, and the dentist there says, what do you mean I can't take out your mercury fillings? I have a license to do that. I can take out your mercury fillings. I don't know what she's talking about. I can do that for you. I'll do it for you, and I won't charge you a dime. I'll just take what your insurance pays. This is her before she had the 3 fillings taken out, and that is her after. Why? Because when you have an MTHFR flaw, let's take me with my MTHFR flaw. If I broke a mercury thermometer and I swallowed it, that would be stupid. I wouldn't swallow the glass because I'm sitting there. But I'm going to take the mercury that's there. My body will discard 80% of that mercury and only hold on to 20%. But when it's the mercury vapor, it's the most bioavailable form you can possibly be exposed to, which means that I'm only going to discard 20% and I'm going to hold on to 80%. If you're in a dental office in the state of California, there's a plaque that says if you're pregnant, please in a because air quality exceeds what the government says is safe for you while you're pregnant. But once that baby's born, bring it in because we'd love to see it and we'd love to expose it to all the mercury we're breathing here. In a biological office, usually you have mercury collectors placed throughout the office to help keep the office safe because you don't want your office to be, that's what happened to me. I don't have mercury fillings. I had orthodontics done. I had 4 wisdom teeth taken out, but my mercury was off the chart because I was working in a mercury environment where they're taking out and putting in mercury fillings, and I was doing hygiene right down the hall from that. It's not just in that hall, it gets through the entire office. So you've got to have equipment in there and you've got to check it. So Ted Herman is a really good example. Ted Herman is a dentist in Florida. He's a biological dentist that's been with us for quite some time. The Academy bought a mercury vapor sniffer. And what I wanted to do was know how long after you drill out a mercury filling does it take the room to go to neutral? You know, if you drill out a mercury filling and then you just take off the mask and everybody and start putting in a composite, y'all could still be breathing toxic stuff. So I wanted to know, so we sent it to about 6 different offices. Ted had gone out of his way when he built his new office in Florida to pay someone to put in special equipment in the ceiling to vacuum mercury out and dump it outside. He didn't care about the EPA, but he wanted it dumped out of the office. Okay, so he gets the equipment. He was 3rd or 4th in line to get it, and he calls me and he says, the dang thing is broken. I said, what do you mean it's broken? He said, it's off the chart. It's like, it's immeasurable. All right, send it in. Let's get it recalibrated. So he sends it in, gets it recalibrated. It costs us $1,000 to do that. Comes back to Ted's office. It's still the same. So Ted has someone come out to help him. The guy that put it in didn't route it to the outside. He routed it right back into the operatory. And Ted would have never known that had we not had that equipment sent out to his office. No idea whatsoever. So they all had to go through testing to find out where their heavy metals were because they were really, really being exposed to mercury. So you really need to find out that the office this office is safe. It's already been tested. So you can be okay over there. You can be okay.
So how
You
long
know.
does it take?
That we haven't come up with an exact number. It's based on what kind of equipment everybody has in their room. So we still haven't, we're in the process of still working on it.
My husband has amalgam fillings, so brushing
Yeah, he's getting this exposure every time he
Does
brushes.
that expose me also?
No, not really. No. The only way it exposes a woman is there is mercury in his semen. So depending on what you do with that semen. And I'm stopping right there. But sometimes that plays into even the action of the sperm. And if that connects and you get pregnant, it could play into it. Usually it's the woman's mercury that's the issue. But I can see where it could be. Okay, I do want to show you this one because it has to do with a couple of different metals. If you can't see that, can you see it on your little chart there if you follow me? I know it's really small, but okay, this is Toby, who you're going to meet tonight. You're going to know so much about Toby, it's not even funny. Okay, so we're looking at the first set of numbers is the reference ranges. The second set of numbers was, October of 2001. We were eating breakfast and he was reading the paper and I noticed the paper was doing this. Toby doesn't drink coffee, so I knew it wasn't jitters and he didn't really take any prescriptions that would cause that. So I said, are you okay? And he said, yeah, isn't that weird that it's doing that? I said, yeah, that really is. So, family members don't get taken care of like real patients do. So I didn't bring home a full heavy metal test. I just was curious about lead, so I brought home partial test and I tested it. So his lead should not have been over 2, and it came back 24. Now, 24 on the doctor's data chart is not just here. It's there. It's really a high number. Toby is from Chicago. He was raised in a floor flat. I don't know if they had lead pipes. I don't know if they had lead paint on the wall. I don't have a clue. And it's not like I'm going to go back and investigate his life over the last how many years to try to figure out the source. I just want to get rid of it. So I start chelating him orally. And most of my patients I would not recheck for 90 days. But he's a pisser and a moaner. I'm getting tired of taking these pills. How much longer do I have to take these pills? Sometimes when I take these pills, they make me taste like vitamin B. I just don't like taking the pills. Oh my God. So I just brought home another heavy metal test kit just to see where he was so I knew if I could stop yet or not. So that's the third set of numbers. That is from 6 weeks after the first set. He was at 24 and he went down to 0.3. So now I'm going to ask you, is he a hoarder or an excreter? Yeah, he's an excreter. Plus, he doesn't have any mercury fillings in his mouth. Okay, so everything that he has is composites. That's not an, you wouldn't do this test if somebody had mercury fillings in there. Why? Because you're pulling mercury out of their fillings. You're not going to get an accurate of what's in the tissues. That's just dumb. There's a lot of physicians that will do it. The Crippen, I know a couple that will do the heavy metal testing. And they still have amalgams in their mouth, and I'm scratching my head. They're doing chelation, and they still have amalgams in their mouth, and I'm going, why? You still have a source. Why are you spending money on something if you still have a source? Okay, so time goes by. Now, if you notice these dates, 11 years go by. My husband and I love therapy. We just love learning about the quirks of why we are like we are. I'm the man in the family. I'm the one that works and brings in an income. The joke is that he's the hife in the family. He's a husband that does wife duties. So he goes out and does the grocery shopping and he sends birthday cards and it's great. I have a wife and I like. Unfortunately, it's a guy that's a wife because I'm not that kind of neither. But okay. So anyway, I'm talking to him one day, and we had just been to a therapy where the therapist told us, when you guys fight, your toes need to be pointing at each other. Don't, Don, you're washing the dishes and he's arguing at you and you're just still washing the dishes because that's not showing respect. So if he's arguing with you, you need to point your toes at each other and have eye contact. And then it would be good if you acknowledge that person by shaking your head. So I am angry about something. My panties are in a wad and I'm going to talk to you and you got to listen to me. And so his toes are pointing at me. That's a good thing. His eyes are engaged. That's a good thing. And his head is shaking. So I'm going, okay, I had my say. Now, you got to know redheads, once we pop off, we're done. Everybody else is walking around. We're okay now that we got it off our chest. We're just fine. Everybody else is upset. So I said, well, you go watch TV and I'll make dinner now and everything will be okay. So he is watching TV looking this way and I'm preparing the dinner and I look at him and his head is doing this. I said, are you doing that on purpose? Am I doing what? And I said, your head is moving. Can you see that? And I said, of course I can see that. Yeah, it's bobbing bad. I got to do another heavy metal test. So I bring home another heavy metal test and I make him do it. Now, if you look at this, bismuth is not supposed to be over 4 and his is 770. Last time it was not bad. So I said, you taking Pepto-Bismol? Because bismuth is the active ingredient in Pepto-Bismol. Maybe. It's a horrible answer. Maybe. You either are or you are not. Yeah, I take it sometimes. How much do you take? Some. Some is not an answer. How often do you buy it? Oh, I get 2 of the big bottles every week. Have you ever read the label? Now you have to know that when we were flying air ambulance around the world, depending on what country we went to, it didn't mean that they had bad water. It's just different bugs than what we are used to. So when you go down to Mexico, they tell you not to drink the water. The Mexicans drink the water. They don't have a problem with it. They come up here to the United States. They can't drink our water because they've got different bugs in it. So when we would go to different countries, there would be, and there was a list of the countries. You cannot drink the water. You cannot have tea. You cannot have a soup. Anything that's made with water. You can have beer. I don't like beer. You can have anything carbonated, like carbonated water, that's fine, or carbonated soda, so that you don't get Teresa. And preventatively, you should take a little bit of Pepto-Bismol. So that's where he heard the Pepto-Bismol, and his mindset is nowhere where mine is. His mindset is, if you buy it over the counter, must be safe, and you couldn't possibly overdose on it. But if you read the bottle, nowhere in there does it say, take the cap off and drink a couple of big swigs. So anyway, I chelated. But in chelation, you use different chelating agents depending on which metal is high. You don't always use, it's not like you read the Andy Cutler protocol, we'll take out everyone's mercury. That's just not true. And some people will get deathly ill on that because they have an MTHFR flaw and they moved it from the inside of a cell to the outside of a cell into another cell and they got sick. So you find out what heavy metal is the highest, you find a chelating agent that will work for that one, and then you work on that one. So with his bismuth at 770, I worked on him. It came down to 17. Well, that's good. Came down to 5.1. Oh, that's really good. We're almost done, right? We're just shooting for 4. Next one comes back 120. Who got back into the Pepto-Bismol? Really? And that's when you have to realize that as much as you try to help all of your patients, you're going to have patients that do not care as much as you do. You try to tell them to floss and what not to eat or drink so they don't get cavities, and they hear you, and then they just go do whatever in the hell it is that they want to do. And no matter how much you love them, you cannot change that. And that was a really big life lesson for me. So I told him, I'm done. I mean, I can't care about this more than you care about it. I can't, because it will just kill me. And even with my patients, sometimes they'll come in and I'll go, I don't understand why this didn't get better. Oh, I ran out of that after the first bottle and I just didn't take it afterwards. Really? What part did you not understand about you need that every day? Oh, I'll do better next time. Well, I'm sure you will be, because otherwise we won't be working together. Because I just can't work with people that are that stupid that I feel bad for them, but they need to go find somebody else that can work with them. But this is a little sampling of what chelation is, and you guys are not going to be doing this in your office, which is why you have to be networking with someone who will. Write down this. There is a group called ICIM. International College of Integrative Medicine, I think. Wendy Chappell is the executive director. Those are most of the physicians and nurse practitioners that have taken courses in chelation. There is another group called ACAM. but I'm more fond of the ICIM. And so, yes, you do want to ask questions because I've got a chiropractor here in town who tells people he's chelating them because he's putting their feet in a foot bath. You really think that's going to chelate? It does pull out some minerals out of your body because I'm the only one that's done research on those foot baths, but it is not a way to chelate.
Are they bad? Like, foot baths?
The foot baths are not bad. What they actually do is it's quantum physics. So it's trickle charging the water to basically send your body more energy so that it can do what it's supposed to do. So the color in the water is arbitrary. It's interesting what comes out in your urine and your feces. But you will also move out iron and magnesium and calcium and zinc and all your good minerals. So if the person were to sit in that too long, too often, they could go into an electrolyte imbalance and go to cardiac arrest. So everything in moderation. Everything in moderation.
So, because they're on the International College of Integrative Medicine, you're gonna say that they know how to chelate the right way after their
They're going to have a better chance. They're going to have a better chance. It's like saying, I've got members on the IABDM that still do root canals. I've got members on the IABDM, they don't use a rubber dam. They don't do compatibility. They joined, they don't even have all the equipment to be able to do safe mercury removal yet. So in order to protect the public, Toby and I spend most of our day, all day on the phone telling people, here is a list of questions. Yes, they may be one of our members, but you must get these answers from each of these questions. And if they don't answer correctly, hang up and move on. Because they joined, and it's not that they're not thirsty and they won't be there someday, but I can't have you assume, like you just said, that because somebody's a member of something that they know how to do something, because they may not.
That's a question about, again, this is just a personal thing for a dentist that's exposed to mercury. You have this testing done, you have high mercury, you need to be chelated. You're still exposed to mercury every single day. Even if you're doing the smart protocols or the protective protocols, we're still exposed to that mercury. So do you need to do chelation?
Oh,
or
absolutely.
should you do chelation?
Oh, absolutely. Yes, I tried to talk to Teresa about us starting a little group where we say, okay, day one, everybody's going to come in with their blood work. Everybody. And we're going to make sure that it's safe for everybody to do the next step, which is a hair test. And then the next step, which is a urine challenge, so that you can see where you are. But for me, when you see one do one, you're more inclined to be able to understand why I might not be able to do this on my family members. Even though it looks pretty easy to do, I don't know all the numbers that make this person safe. But at least we would have a whole group of dentists that we cared enough about to say, some of us are going to go on NDF, some of us are going to go on zeolite, some of us are going to go on EDTA based on what heavy metal is the highest. You can't just say, here is NDF and it works for every heavy metal. It just doesn't. And then if it's something that pulls out something else, like if it's EDTA and it pulls out too much zinc, if you are too low in zinc, you're going to have problems. So we have to put the zinc in. But I would love to do that as a whole group that gets together maybe quarterly. And we say, hey, this is what we want to do. We want to focus on our own health.
What do you think of TriTest?
What do I think of who?
TriTest.
Oh, the TriTest. Yeah, we were talking about that earlier. I don't think that it shows enough heavy metals. I don't mind the hair test on there. What I don't like is it's too difficult to explain to patients where it is on the graph in comparison to what I'm able to show on the graph from doctor's data. That's just a personal choice. Okay, so heavy metal toxicity. Let's take a 5-minute break. Let everybody potty. Vitamin C can move heavy metals from the inside of the cell to the extracellular space. Somebody that has an MTHFR flaw or is low in glutathione, when you move too much out to that extracellular space, they feel bad. They feel really bad. They will call you up and tell you that you are killing them. They're dying. What is it you're doing? So you're just moving too fast. You have to move slower on those people. Chlorella, although we've used it for many years to try to help clean up some of those extracellular spaces, you have to be careful about that chlorella and where the source is, because some of that chlorella has other toxins in it. Okay, so when not to remove mercury in somebody's mouth. When the dentist is untrained in the proper protocols, probably not the smartest thing. I actually tell my patients, I would rather you leave it in your mouth than get it taken out wrong. So the example I showed you on that lady that had the MTHFR flaw, where we went from high lead and mercury to really high lead and mercury, that would take 30 years to get out of her body. Now that she's gotten it at such a high level, why would you want to do that to yourself? So if you are in doubt, just leave it in place until you can get to somebody who can take it out appropriately. When a woman is pregnant, just not the smartest time, especially if they're not going to be following a protocol. And when a woman is breastfeeding. Now, does that mean that there aren't extenuating circumstances? Of course, there's always extenuating circumstances for everything. So in that case, then you would have the woman pump and dump.
For how long?
3 days is what I tell them. So testing dental materials, now we're talking about compatibility. Most of you are very aware of Clifford testing and Biocomp, right? That's where you draw blood. You draw your blood, you spin it down, you ship it off on dry ice. It takes 2 or 3 weeks for your results to come back, and I think it's somewhere around $400 or $450 to get your test results. It does not test anesthetics, doesn't test sutures, and there's a few other things that it doesn't test. I don't know, what do you?
Is that veterinary court testing? Is that veterinary court testing? No.
The Clifford testing?
Uh-huh.
Yeah, it's Clifford and Biocomp. Those are the only two that you actually, yeah, they don't test anesthetics and they don't test sutures. But now let me ask you something. If your patient has lived in Russia all of their life and they've never had a strawberry in their life, and you want to fill their tooth with this brand new strawberry filling, and you do a Clifford test or a Biocomp test, it's going to come back safe. Do you know why? All right, they've never been exposed to a strawberry before, so they can't have an antibody to it. There are so many chemicals in dentistry, so now it means that all the things that come back S, which is safe, are really question mark. That doesn't feel so good for me when I found that out. I ate dinner with Jess Clifford one night, and we were talking about compatibility testing. And what I didn't know is that children that are under the age of 12, there's changes constantly. They haven't decided what they're allergic to and what they're not allergic to. So they caution people about doing compatibility tests on children that are under the age of 12. When you are doing the compatibility test, you will want to know about everything you're using. You'll want to know about the anesthetics, the filling materials, the crowns, the cements, the temporary materials, the denture materials, orthodontic materials, bleaching, toothpaste, absolutely everything. There is nothing as good as what God gave you originally, which is why we really should be more on a bandwagon for prevention. If you really wanted to do something cool to make your office stand out, you would do some kind of community service where you would either reach out to a nursing home and you would go in and you would brush people's teeth. Once a week, you go in and you just brush whoever's teeth are in there. You take a bunch of toothbrushes in there, you brush their dentures, their partials, their teeth, because you know the nurses aren't going to do that. They already got grossed out, and there's no way they're going to do it. Second thing would be to get connected with some kind of after-school program where you just go in and teach kids how to take care of their teeth, what foods to eat and not eat. Those will make the biggest impact. There just is nothing as good as what God gave us the first time. My frustration is that in dentistry, we think about what will last the longest, not what is the healthiest. So again, I'm going to choose the state of California. The standard of care, if I asked for a crown here in Texas, and I did not want a metal crown that showed metal, then the standard of care is I would get a nickel or a non-precious crown with porcelain baked on top. Everybody knows what that looks like, right? Just a PVC crown. In California, you have to sign a waiver that says that you understand that this crown has nickel in it, and nickel is a known carcinogen. We don't have to tell you that in Texas. It's supposed to make you stop and say, that's a really big word, carcinogenic. What does that mean? It means it could cause cancer. You know, do you have a problem wearing inexpensive earrings? Oh yeah, I can't do that. Yeah, make my ears all swell up. Okay, well this crown is going to have the same kind of nickel in it. Well, I don't want that. What's my option? Well, you could go with a zirconia crown, which is all porcelain, but your insurance might not pay the same amount for it. Yeah, but if it's healthier, that's what the patient needs to know the information on, and let the patient make the decision. It is not my goal that we use something that lasts so long, but the patient dies earlier, and we're looking at him in the coffin going, dang, isn't that a pretty crown? I put that crown in. It's just not an option. So I try to teach my patients, I would really rather have you outlive your dental work, even if it means you have to have it done again. And you guys need to think about what informed consent is, because informed consent means you give all the options. So I'm going to give you an example, which is Toby. In 1999, Toby had a dot on his arm. I got dots all over mine, but he had a little black dot, tiny, tiny little black dot. And I said, I don't remember that being there. That doesn't look good. You need to go to your primary care and get a referral to somebody in dermatology and have them take a look at it. I mean, it's not like you can just go to a dermatologist, duh. But he did. He went to his doctor. His doctor said, yeah, I see that, but it doesn't look like anything. But let's go ahead and send you to a dermatologist. So the day that he had the dermatology appointment, I said, do not let them do a scratch biopsy. Please ask them to do a punch or a wide excision. Okay. I couldn't go with him that day. He used to be a paramedic. I figured he's smart enough cookie. He can remember what I just said. No scratch, punch, or wide excision, okay. The doctor looks at it and says, it doesn't look like anything. I tell you what, though, we'll go ahead and set you up for a biopsy while you're here just to save you an office visit. I had my nurse come in and said, we'll do it in just a minute. So the nurse comes in. Informed consent means she's trying to explain, oh, by the way, what we're going to do is called a scratch biopsy, which means that we're just going to take a little scratch of this area and we're going to send it out to the pathology lab and we'll call you when the results come back. Well, my husband, his eyes get real big and says, I can't do that because my wife's a redhead. What does that have to do with anything? No, see, she told me something this morning and now I'm all flustered. I can't remember what she told me, but I'll come back another day when she can come with me. And so the nurse leaves and says, this guy's cuckoo in there. So his wife must beat him with a stick, silly. But so the doctor comes in and says, what's this about your wife and you getting all upset? And he said, my wife told me something specific and all I can remember is she said, don't do a scratch biopsy. I can't remember why. I can't remember anything else. And so the doctor said, would you feel better if I talked to your wife? And he said, that'd be fine. You talk to my wife and you get it all straightened out. I'll do whatever. So the doctor calls me. Hi, I'm Dr. So-and-so. I've got your husband over here. And he's worried about doing a scratch biopsy. And I said, yeah, I really don't want him doing a scratch biopsy. What kind of doctor are you? And I said, well, I'm a doctor of integrative medicine, which is a PhD. Oh, you're a PhD. No, you do not do that to me. You want to see my panties getting a lot real fast? I said, true, I'm not an MD. I do have different degrees in different things, but what I learned in school in oral pathology is if you scratch it, the body has to make a choice between healing the boo-boo or fighting the cancer. And it'll choose the easier of the two, which is to heal the boo-boo. Now, if you think that this is not going to come back cancer, then you do whatever you want. But if in fact you do something like a scratch biopsy and it comes back anything other than normal cells, I'll have your license on my wall. Because informed consent is you let the patient decide what needs to be done. Why would you not let him do the punch or the white excision? Lady, your husband's insurance will pay 100% for the scratch biopsy. I said, how much is it going to cost for a punch? $57. Do you think he doesn't have $57 to give you? No, it's just that we can't take the time to explain to every patient what all their options are. Really, but this is a patient walking in asking for something. So, unfortunately, his pathology report came back melanoma stage 4, which meant that it had gone someplace else. Toby comes home mad that day. You know what it's like to have someone come at you with a thing to stab your arm when his wife has just chewed his ass out. And I said, I did not do that. But yeah, I was a little stern, so I could understand where it probably was thick here. But that was unprofessional if he came back in and he was rude. Well, no, he wasn't rude. It's just that he didn't talk to me and he didn't have any eye contact. But when his report came back, that doctor against HIPAA, because who should he have been talking to? Me? I'm the wife. No, should have been talking to Toby. But he called me and he said, I want you to know that the day you talked to me, I was upset. And I was upset all day long. But when that path report came back, I sat my staff down and I said, do you know that that is the law? Informed consent. How many times I deal with somebody where I'm looking at a Panorex and I'm talking out loud as I'm charting on here. Okay, you had your wisdom tooth taken out here. I see you have a crown here. I see you have a root canal on tooth number 3. I don't have a root canal. Yes, you do. You got a root canal right there on tooth number. I've never had a root canal. You do have a root canal on tooth number 3. I've never had a root canal. I paid for a crown that day. You might not have understood that they did a root canal, but really, they don't know what's in their mouth. It's so frustrating. We had this conversation with a physician, and the physician said, why do you have to take a Panorex in order to do the test you do? I said, because my patients are stupid. They have no idea what they've had where.
I had a patient just 2 weeks ago. She had a root canal on one of the tooth, and we were doing surgery on her. I do a CPCT on all my patients. So I showed you have one more root canal on that other tooth. She's like, no, I don't have that. Like, that's your CPCT. And I just take all different sections. That's just the largest. And she's like PhD guy. She's very nerdy. She look up everything. So she went back to her record. She called her insurance company to dig up the claim to see what the doctor had done. And she has been going to this doctor for the past 25 years. And I don't know what happened because I just don't know what the story there is. He did send a claim for a crown, but did not send a claim for root canal. But he did a root canal.
Yeah,
He was so sad.
you did it on the wrong tooth, and they did it on the convex. Well, she couldn't believe it. It's true.
He was like, "It's crown." No, it's sure.
Yeah, it's just super, super frustrating. But as a patient, and so we have to remember that. So if a patient comes in and they are expecting to have a DO composite, and it gets deeper, and you end up having to do a pulp cap, you need to set the patient up, stop whatever you're doing, and have a conversation, and probably even have them sign something that says, our treatment plan just changed, and here's what happened. And we're having to do a crown, or we're having to do a pulp cap, or heck, we're gonna have to send it to an endodontist because we see pulp, and we don't know what else to do. But if it changes, you really need to document what the options are. The option should include, even though I'm against root canals, it should include, you have the right to have this tooth treated by an endodontist and have a root canal done. You have the right to have the tooth taken out. You have the right to do nothing and just sit there and suffer in pain and beg me later to do something. But it is your body, so you have the right to do all of those things. But you have to document every one of those. Otherwise, you never told them a thing. unless it's written down. So you find some kind of shortcut to put that in there. Okay, the blood serum compatibility, which is what I was talking about just a minute ago, really only looks for things that you have had an exposure to and you have developed an antibody to. That's a flaw in the system. When you are looking at it, they cross-reference it and come up with all that information. My God, there's 17,000 different dental materials. You get this thinking manual back, that's this thick, that says S or NS after all of those. So now you know when it says S, does that mean it's safe and you can use it? No, it means question mark. They may have never been exposed to it. Then you've got another metal allergy testing, which is really only for metals, and that's the MELISA test. So I give you the information on here about that, and you will find that mercury comes up on a huge number of people. Nickel also comes up on that. And then here's the information for the biocompatibility testing for both Biocomp and Clifford Laboratories. I mean, if you don't have somebody that does muscle testing or EAB, this is better than nothing. You just need to know that there are limitations.
So like either the EAP or the muscle test, you want to use the biocompatibility.
And then you've got that urine porphyrins that we were talking about. So it does give you some information about mercury in the body. I've got some results on some urine porphyrin testing that I did when I was doing some research on some kids that were in the autistic spectrum. Okay, so let's talk about the EAV versus what you're doing for blood work. Okay, now I started working with Bill in 1993. The only reason I know that is because that's when Trevor was born. And we were doing blood serum compatibility. I went to a meeting and there was a dentist sitting next to me. I guess I'm drawn to old guys. I don't know why. But anyway, I sat down to this guy. He's 90 years old at the time, and he was still practicing biological dentistry. In 1993, think about that. That's amazing. That he even knew about biological dentistry back in 93. So he looks at me and he says, how do you all do compatibility testing? Oh, we do the gold standard. We do the Clifford Laboratory. Biocomp wasn't even around there. I draw blood, we spin it down, we ship it off on dries. Takes a couple weeks for it to come back. And he said, yeah, we used to do that. Used to. What do you do now? He said, well, we do this technology that's out of Germany. But why? Well, then when he started to explain to me about the strawberries and how if you've never been exposed to something, you can't have an antibody. And I'm going, okay, wow, you put doubt in my mind. If you put doubt in my mind, I can't be behind something. So I'm going, well, this is just not good. What am I going to do? And then he goes on and he says, a bunch of my patients, we eat organic. In 93, I wasn't really sure what organic was. I thought organic was stuff you got at the grocery store. I just didn't know. And so he said, yeah, I'm doing some testing on some of my patients. And this equipment that I use, it seemingly says that a lot of these people are not good with gluten. So what's gluten? And he said, oh, it's in a lot of different foods that you eat, like things with wheat. He said, so yeah, what I did though was I made an appointment for all 10 of us to go into a gastroenterologist. Now he was from, I can't remember whether he's from Portland or Washington State, but he's up in a greener area than Texas is. I mean, they like cared about recycling and stuff that we didn't care about here in Texas at the time. And so he says, I made an appointment for 10 of us to go into this gastroenterologist in town because all of us showed up with a problem with gluten. And I said, okay. And he said, but the darndest thing, the gastroenterologist walked out and he said, are you the dentist that's like in charge of this group? Yeah. Can I see you out in the hall? Sure. You have overstepped your boundaries. You are outside of the scope of your practice. You're telling all these people that they have something called celiacs. There is not a single person in the United States that has celiacs. That's the disease of Europe. So mind your P's and Q's and go home. So he had to go in and say, this guy don't want to work with us. He thinks that it's silly that we would be having a problem with gluten. So let's all go. But they decided as a group that they would not eat things with gluten in it. And amongst themselves, they saw improvement. Well, this guy dies about two years later. And how do you think he died? On a motorcycle. He was driving the motorcycle. This crazy guy, 92 years old, riding a motorcycle. But anyway, I am now probably 6 years out. I'm at another meeting because part of my job as the executive director is to go recruit, so I'm supposed to be finding people who are on the edge and try to sway them my way and into thinking about biological dentistry. So I'm sitting next to this lady. She's an allergist. She's not a dentist. And we start talking about this kind of testing using the EAV. And she said, I never heard about that. But I will tell you one thing. I have more people coming in, and I don't know where they're getting this information, but they come in and they literally spell out word for word what somebody would have if they had celiac disease. But the only test that we have is to do endoscopy and go down and snip some of the villi. And if the villi is too short, they have celiacs, and if it's regular length, then they don't. And I'm going through hoops testing these people, and I'm going to tell you 9 out of 10 don't have shortened villi. I don't know what to tell them. So we leave, and about 2 weeks later, she emails me the cover of a magazine for allergists. New terminology, gluten-sensitive patients. Those are the ones that when you do testing on them, they don't have antibodies. They just don't have them. But they are sensitive to them, and they can tell you what it does. It makes me bloat. It gives me diarrhea. I'm fatigued afterwards. They have all these symptoms. So that is the difference between when you get results for muscle testing or for EAV versus when you're doing blood work. The blood work is looking for an antibody only. And if you don't have an antibody, there are still things that you're sensitive to. So another example I use, you will see me at some of the conferences with this really wide gold chain. It's a 7.5 millimeter herringbone chain that I have slides for. It's gorgeous. But every time I wear it, I don't feel good. So as soon as I can get done with my day, I'm popping the whole thing off and setting it on the counter or doing whatever. There are people that the moment I see their name on the schedule, I'm going, help me, Lord, make it through the day. I do not want to see them. I'm not allergic to them, but energetically, we're not a good match. Do you guys understand what I'm talking about? So energetically and antibodies are two different things, which is why I have become more comfortable with the energetic testing, which is why I do EAV. I don't care what you do. It's just dumb for you not to do anything at all if you're really working with some of these sensitive people. When you do applied kinesiology, which is muscle testing, all you get is a yes or a no. I'm strong, and now you put Herculite on my hand, and you press, and it falls down. Herculite's probably not good for me, so you wouldn't use it. But now I'm strong, and you put Valplast on the top of my hand, and I stay strong. Okay, I can probably tolerate Valplast. Does everybody understand that concept? It's just a yes or a no. Whereas when you're using EAV, you get numbers. So 50 is a perfect smack on. If my reading is 50 at the beginning, it's as if I could measure how strong this arm is. And then if it stays 50, it's perfect for that person. If it goes to 49, it's okay. If it goes to 48, it's still okay, but it's dropped a little. If 51, 52, it's still okay, but it's not 50. So you get to go through that list and pick, wow, I've got this material and it's sitting on the fence versus, it's a 46. It's 1 point low. I think I'm going to try it because it's only 1 point low versus you finding out it's a 20. Oh, not just no, do you not use it, but hell no, you're not going to use it. So it really gives you a better sense of just weak and strong. It's kind of like saying you've got people that put a watch on and their watch stops. Well, they're not allergic to it, but somehow they're in energetic competition with each other. And, some of these people come in and they are so riddled with candida that they can't tolerate anything. When you talk to them, they'll tell you, I'm eating lettuce, and some radishes. Because everything else I react to. Once they get healthier, they start being able to tolerate more items. Now, can the flip happen? Certainly. You could be able to eat everything under the sun and now you have cancer and you can't eat what you could eat before. You know how to turn that down? Somehow it turned up, the music. It's in that closet. Yes. Okay, so I found this picture years ago and I love it because that's how I feel dentistry is. It can be toxic. We don't even know that we're being exposed to it. I do remember, I'm not sure that I can remember the year. Maybe in 89, somewhere around in there, we got a notice that says that dental offices had to have an MSDS book. And my sister-in-law at the time was the dentist that I was working for, the one that I was dragging on firemen in. And I said, what do we have this toxic in a dental office? She said, I don't know. Maybe the fixer and the developer solution. And I said, well, yeah, you can't drink that. So I guess it could be toxic. Oh my God, I had no idea that we had so much stuff. So we started working on the MSDS books and I just had no idea that you were being exposed to so much stuff. And when you really took the time to read it, so now you read plaster Paris. So you're making a model, plaster Paris. You must be wearing protective equipment for that, for your eyes, and a mask because long-term inhalation can cause cancer. Oh, I didn't know that. How many years did I pour plaster Paris without it? So it is for your protection. The downside is most dental offices are not incorporated. Therefore, they're sole proprietor, and that means that they're the owner of the business. And I guess they can choose to kill themselves because they don't have to follow the rules. They are supposed to provide that protective equipment for their employees. Once they're incorporated, now the dentist is an employee and he's supposed to do that too. But I cannot tell you how many offices I've been into Toby and I teach CPR. And we go into dental offices and teach CPR as well. Where at one place I had a lady tell me, wait a minute, are you telling me we have to take the gloves off when we leave the room? Because we just wear one pair of gloves for the whole day. And we just wash them as we go from room to room. And I said, you can't do that. You cannot do that. Well, no, I don't think our doctor's going to let us use more than one pair of gloves in a day. No. Oh, okay, worse than that. I'm talking, and we're talking about OSHA rules and regulations. And this is not even in OSHA class. We were just randomly talking about something. And I said something about the carpules. And the one lady said, well, no, wait a minute. Are you telling me that the carpules can't be reused? Because if there's still half a carpule in there, I just put it in the next person's. And I said, oh my God, your doctor injects and aspirates, which means that there's body fluid inside that carpule. And now you're telling me that you are using that on someone else and then injecting? Nobody told me we couldn't. So you don't know what's going on in an office if you're not in there. Because some of these people never went through any formal education other than they just finished high school, went into a dental office, and they just do what somebody tells them to do, and they're trying to save money everywhere they can. I have been in offices where they try to sterilize the disposable suction. I have been in office, and I'm talking about the skinny ones, not the long, hard ones. I have been in offices where they try to sterilize the rubber cups for the Profis. And, insane. Where you just really have to draw the line and say, if I'm going to be here today, we are going to throw these out. Okay, so all of dentistry can be toxic. You know, when we've got fluoride, we're talking about the fluoride in the public water. When I was little, it was a big deal that water got fluoridated, and we thought that that was a good thing. It's not necessarily a good thing. If you would read the book, The Fluoride Deception, I'm going to skip through some of the fluoride here because I really would love you to read that book. I participated in fluoride studies in school. I thought fluoride was good. I'm the one that when I got out of school and was sitting in some kind of a city council meeting with these stupid hippies that homeschool their kids, which we homeschooled, so I can say that I was dumbfounded that these ignorant people didn't want fluoride in the water. Who wouldn't want fluoride in their water for their children? Only to find out later that fluoride decreases your children's IQ by a lot and sets you up for cancer. That the reason fluoride is where it is right now is because as we were making atomic warheads, there was spillage of fluoride into the water. So the government stepped in and asked the American Dental Association. At that time, dentists could not advertise. You could not advertise other than to say, Dr. Smith, DDS. You couldn't say that you were cosmetic dentistry or that you did biological dentistry or pain-free dentistry. You couldn't say anything. You couldn't have an advertisement in a magazine. You couldn't do anything to advertise. It was just your name. And so the FDA came in and said, we will advertise that people need to see their dentist twice a year if you will come up with some kind of a seal that you would put on something like toothpaste and put some of this little fluoride in the toothpaste and tell people it's okay because people were getting sick from the fluoride that was being done. Read the book and you'll want to vomit afterwards about how deceiving the government was through all of that. It just so happened, another God thing, I'm on my way to Utah, to Salt Lake, and I'm reading the book, and the guy that was supposed to pick me up said, Dawn, I'm so sorry that we're late, but we were having a city council meeting here talking about fluoridating the water. And I said, oh my God, did it pass? No, we postponed it till next month. And I said, here, I just finished reading this book. You've got to read this book and then take the city council with me, make everybody read it so that you can see just how we were duped. So it is amazing. When you look at the statistics of countries that have taken fluoride out of the water, there's not a decrease in decay. There's not an increase in decay. It's all about us going to people and teaching them how to take care of their teeth and about seeing a dentist twice a year, because that isn't what was happening before then. You went to see the dentist when you had a toothache. Okay, so I am going to run through that part. I do want to show you this, though. Let me get to it. I put a picture in here. Really? No, it's not in there. Okay, it's in another presentation I have. Pick up any tube of toothpaste that has fluoride on it, and there's a warning label. You know why? Because more kids die of ingesting fluoride in toothpaste every year. And because one family's child died, they ended up having to put a warning label on there because that's what they mandated in their lawsuit. Why would you have to put a warning label on toothpaste? So you just get toothpaste that doesn't have fluoride in it. Actually, I teach people don't use toothpaste at all, because when you get a good taste in your mouth, you think you finished brushing your teeth. Then you're driving down the road and you feel, I missed that spot. So if you will just use no toothpaste, brush your teeth until they feel really slick, and then I don't care what you put on there. Put an essential oil on there, rinse with a mouthwash. Don't use one with alcohol because it'll just promote bad bacteria. But if you can do that, then you'll do a better job brushing. Okay, so when you find a biological dentist, those are ones that are going to be using, and of course, when this slide was made, this is a SMART protocol that I'm not allowed to say anymore, other than I am also a member of the IAOMT, so I guess I can say it from there. Ours is the PROTECT protocol. These are things that I bet you didn't know. One amalgam, one mercury filling, weighs about 1 gram. That 1 gram contains 1/2 of a gram of mercury, because an amalgam is 50% mercury. So if we look at the average adult who may have 10 fillings, it means that 5 grams of mercury are available. So let's put it in a way everybody can understand. 1/2 gram of mercury in a 10-acre lake. So now we've got a dead person with 1 filling in their mouth warrants a fish advisory. Now you can understand why crematoriums are taking out people's teeth before they go ahead and cremate them. Interesting fact, I'm sitting at a meeting, and I'm very opinionated, I get that. And I had one of our members that came up to me and said, I watched you talk to this dentist, and this is what I perceived happened. do you still use amalgam in your office? Oh, you do? Oh. And I said, I didn't say that. As soon as someone tells me that they use amalgam in their office, I see it as an opportunity to plant some seeds to educate them to try to change them. I don't do this or anything else. He said, yeah, it's all in your body language. I'm going to encourage you to try something different. Okay, fine. So who am I sitting next to? An older guy, because I guess I go sit down next to older guys. But this guy's an older dentist, and I can see he's bored. He's doodling. He's not paying attention to the speaker. So I get on my computer, and I find a website, and I kind of turn it to him, and I write a note that says, what do you think about this? And he looks at it, and he says, cool stuff. Can you email it to me? And I thought, whoo, I know how to get somebody's email. Okay, sure. So I emailed to him, and now he's not paying attention at all, and he's reading through this. And lunch comes, and he says, I'd like to talk to you about that. Did you read that at all? And I said, I read through bits and pieces of it. Well, let's go have lunch together, and we'll talk about that. Okay, now I got a lunch date. So I'm over there talking to this guy. We are almost done for the day, and the guy who challenged me to find a different way to approach people that still use amalgam, because this guy still was using amalgam in his office, comes up to me and says, hey, Dr. So-and-so, I want you to meet Dawn Ewing. She's the executive director for all the biological dentists. And this guy says, oh, really nice to meet you. And I looked over at this guy and I went, oops. I didn't tell you everything about who I am or what I do. And he said, I'm not believing that. Well, anyway, it was interesting because he went home to South Carolina. He emails me and he said, I need you to fly out to my office. I said, why? He said, because my staff thinks I fell off another planet. My hygienist is rolling her eyes about not using fluoride. My dental assistant says she don't want to learn anything new. She's been working for me for 30 years, and all she wants to do is go home and play with her grandbaby. She don't want to learn anything new. And I said, that's the stupidest thing ever. So it's like your front desk person saying, Windows just came out with a new version of Windows, and I'm not going to learn it. I said, there's no job that stays static. Everybody's job has to change, and we learn things, and we grow along the way. So I did go out to his office, and he ended up firing the one assistant that was just unwilling to make changes, and everybody else kind of slowly came on board. But that's a big deal that we put that much mercury. How many dead bodies are found, from the mafia dumping people? We've got a lot of polluted water everywhere. The most interesting thing is the person that challenged me. He said, I'm going to accept the challenge in reverse. I'm going to go home and see what I can do. He's over on the East Coast too. So what he does is he calls the EPA and he says, I had a mercury spill in my office. What? How'd you do that? Just as an accident. We have a mercury spill. You got to get everybody out of your office. We'll be out there right away. Just close the doors down and walk out. He said, well, I'm pulling the MSDS sheet right now. No, just get out. It's toxic. Get out. So this guy shows up in his suit with a Geiger counter, walks through the office and says, I can't find anything in your office. Well, yeah, see, we're a biological office, and I did pull the MSDS sheet, and I put down all over vermiculite and everything that it said to do. I cleaned it up as best I could. No, I can't find any mercury in your office. I know, that's what I said. We're a biological office, so we've got things in our office like mercury traps and all kinds of things to help remove. He said, no, you don't understand. We go into state buildings, and state buildings have more mercury than what you have in your office. You go into state buildings? You ever been to the dental school? Well, I'm sure we have. He said, well, when you get back to the office, can you tell me how the dental school did? Yes, what's important is that you have this piece of paper. So let me sign right here. You can see your patients tomorrow morning. You're clear to go. Okay, thanks. So he gets a call and he says, we've never been to the dental school. And nobody's ever even thought about it. It's a state building. We should have gone, but we've never, ever gone. He said, well, that's cool. When you go, can I go with you? Sure, I guess so. So they go to the dental school, and of course the dental school fails. Why wouldn't it? Those of you that are hygienists, I'm sure you had to do like I had to do. We had our little model that we had, and we had to put a filling in there and be able to carve it out. Why, I don't know, because hygienists don't place amalgams here in Texas. But we had to do that and learn how to make a crown and a bunch of other stupid stuff that we never had to do anyway. They got cited because it's an open concept and there's mercury vapor all over the place. That's not what they got cited the most for. The first year dental students who were putting their amalgams in their little models, when they were done, were chucking it out and throwing it in the trash can. Well, you can't do that because then it ends up in landfills. So they got cited for that. So when the EPA guy came in to talk to the dean, the EPA guy said, that dude that came with me, he's some kind of a funky dentist, and I don't even know what it was he said he was, but he has all this unusual equipment in his office. Maybe we should talk to him and see if it could help the school out. So they did. They contacted him, and he is in the middle of writing a criteria to teach dental students how to take out mercury fillings so as to not pollute the environment. It's still nothing about having the patient protected or the student protected, anything like that. Now here at our dental school, I talked to the dean, and he said, we didn't put mercury fillings in hardly ever because it's only a difference of $3 between an amalgam and a composite. And most of these poor patients can come up with an additional $3. I said, but that's not the issue. The issue is if you look at the makeup of the demographic of the dental students now. When I went through, of course, it was hygiene school, and that I already told you that was in 1975. There was maybe one girl in the dental school, maybe. And now it's about 60% female. So if all of those women are childbearing age and they're being exposed to mercury vapor, at some point in time, there's going to be one hell of a class action lawsuit against the dental schools. And so I said, Dean, what if I'm protecting the school from a class action lawsuit? I mean, you won't even let these girls wear a mask. You won't let them double glove and then, wear mercury cream underneath. You just won't let them do anything, and I don't understand that. So, but that's kind of the ignorance of the schools right now. Right now, it's all about protecting the environment. So you do need to know that we've got elemental mercury and we've got inorganic mercury. So the elemental mercury, when you're exposed to either the liquid or the vapor, you have 80% uptake by once, and it does cross the blood-brain barrier. And there's moderate uptake in the intestines. Whereas when you're dealing with the inorganic mercury form, it's poor uptake in the intestines, poor mobility, and it does not cross the blood-brain barrier, but it does cause inflammation in the gut. And then we've got chemical forms of mercury, which are the methyl mercury, which 95% of that is taken up in the intestines and good mobility, and it does cross the blood-brain barrier. And you've got the ethyl mercury, which is the thimerosal in the vaccinations, 100% absorbable, crosses the blood-brain barrier, and breaks down into elemental mercury. Okay, so not everyone is allergic to mercury, but it is toxic for 100% of the population. And that is what I need you to know. It's very interesting, when I was doing some research on the American Dental Association website, they own the only 2 patents that are left for mercury fillings. They own them. They are very careful to say that if you were going to have a mercury filling removed, you should probably see someone who could help protect the environment, because it could be an environmental exposure if it was taken out wrong. Other than that, they don't feel any responsibility that they're being exposed at all. So what's in mercury filling besides amalgam? You've got a trace of zinc, 2% copper, 13% tin, 35% silver, and 50% mercury. So let's say this were a cereal, and mercury was the majority of what the cereal was made of. It would have to be the very first thing listed in the list of ingredients, correct? And if you're saying something about it, then you wouldn't call it a silver filling. You call it a mercury filling. So you have to be really careful when you're talking to patients, because, again, in the state of California, the way it's listed in the state of California is they have a waiver for you to sign. If you're a woman and you have 6 children and you are indigent, state of California has a law in place that no dentist is allowed to put mercury fillings in your children's mouth. If the dentist is there, they may not get them out. But now you're the same woman and your husband just got dental insurance. So now you're going to get a piece of paper shoved in front of you, and if you read it, it will say mercury is a non-neurotoxic, which is supposed to make you ask the question, well, what are my options? Well, your options would be to have a positive. But the way it gets worded becomes essential. If I got a baby on my head, what is it I'm signing right here? Your insurance will pay for a white filling, but it'll pay for the pretty silver one. That is not what that paper says, but it's all in how that was presented. And so if the mother is sick with these kids tugging all over the silver sign, nobody said anything about it being mercury and it being toxic. How the state of California ended up in that was Andy Landerman lost his license, and Arnold Schwarzenegger, can't say his name, Arnold Schwarzenegger became governor. They were doing some research, and what they found was the inmates had low levels of serotonin. Serotonin in the gut, remember? We already talked about that. But high levels of mercury interfere with the receptor sites. So even if you had serotonin, it can connect for it to be able to work. So then they started polling these prisoners and saying, you have mercury fillings? I got all methyl mercury fillings. Where did you get them? Oh, state put them for me, indigent care. So somebody finally said, we have to stop this because we're paying and then paying and then paying. We're paying for poor dental care and something that's toxic, and then they're becoming criminals and having anger management problems, and we end up having them in jail, and then we're paying for them for the rest of their life. We have to stop this, which is why they came up with the ruling that if you're indigent, you can't have any mercury fillings placed. Now, there are other states and other countries where what they've said is if you are if you're pregnant, you can't have a mercury filling place. That's in Canada. If you're under the age of 12, you can only have a couple of mercury fillings placed, and you can't have any more than that. And in some countries, you can't have one placed at all. I have a patient here that is from Germany. And in Germany, you can't have another place. She married an army, a guy in the army, and then she went to the army base to go get some dental work done, and she got mercury filling. And she said, oh my God, I'm in my own country where you cannot place mercury filling. And I have a mercury filling in my mouth because the army dentist put it in. I'm not leaving it. And then they didn't have to take it out. So she ended up here having mercury filling taken in. So I put some things in here about the occupational, all the OSHA rules and regulations. Basically, there are OSHA rules and regulations that if you are placing or removing mercury fillings, your staff needs to be protected. And that means that your staff can sue you later if they had a miscarriage or they find out they have heavy metal poisoning because you did not provide PPE equipment for them. We've got the genetics that play into a lot of this. Part of this is the APOE, and this is again part of Boyd Haley's work. The APOE, if you're a 4-4, you get a 4 from your mom, you get a 4 from your dad. It is not if you get Alzheimer's, it's when. Now, a lot of people just don't want to know if they're 4-4. My dad is 4-4, and he has Alzheimer's right now. You're not 4-4.
Probably.
No. This is Grandpa Don's not biologically yours. Don't go there. Interestingly, though, when you're looking at research, you look at research and they'll tell you drinking a glass of red wine to make your good cholesterol good. It will if you're an APO 2-3. If you're an APO 4-4, it'll make your bad cholesterol go up. So it just depends on who's funding the research. So whenever you're looking at research, do try to pay attention to who is funding it. I put some information in here about APOE that maybe is more than what you need to know for today. The components of dental amalgam filling are transported to a dental office in a hazardous waste container. Did you guys know that when I was going through the dental program, you had to have the glass jar, you put your amalgam in there with water on top of it, and then you sealed it. Did you know that that is not proper protocol anymore? There's no water. Did everybody know? You know what you're supposed to do with your waste stuff? Yes, and now you have to have a mercury separator in your office. So when you suck the spit up, it doesn't go out into the municipal water, because it's all about saving three-eyed fish and frogs. It has nothing to do with people. Yes, all the rules according to the American Dental Association, the amalgam that you get in the little pre-dispensed vials needs to be opened by the dentist and his staff, prepared or mixed, placed into an amalgam well, picked up by an amalgam carrier while the staff are wearing a mask, gloves, so there's a no-touch policy. So the only place that mercury filling is safe is in your mouth. It's not safe, it's toxic before you put it in, and it's toxic waste when you take it out. So you might as well just leave it in your mouth, because it's the only safe place. Which is basically what we have written in here. Okay, and it's true, mercury is number 3 is the most toxic material known to mankind after arsenic and lead. And that's why I put that in. According to the American Dental Association, the only safe place to store dental amalgam restoration is in your mouth. Okay, so does the ADA have a vested interest? Yes, those are the 2 patents that they own. And of course, they send money to the dental schools too. So the dental schools are not in a place yet where they're telling people not to do amalgam. I do believe that New York's dental school is the first one to take it out of any of their requirements. I don't know if you can quote me on that yet, but I don't know of any other dental schools that are there yet, certainly not here. Proposition 65, which is the proposition that I was talking about, educating the person, is not just for the patients, for the staff as well. It was to try to encourage at least letting the dentists know that you're working with something, and yes, it can be a problem. So here's what they did in Germany. In Germany, because a lot of countries follow what we do here in the United States, Asia is real big about following what we do here in the United States. And so they were having a lot of problems in Germany. What do you mean we can't use mercury fillings anymore? What do you mean we've been using them for so long? What do you mean if they're toxic? So what they did was they had a very, very smart lawmaker. One person made this decision. Okay, you guys can put in whatever you want. But if your patient can come back and show bodily harm because of what you used, you're personally liable. You won't find a dentist that'll put in a mercury filling, because they're too scared. They've got better options out there of other things to do. Why would they use something that if somebody is smart enough to figure out, to come back later and tell them it's a problem? It's not only talks about mercury, it also talks about nickel. So we talked about the fact that most of those PVC crowns are nickel-based crowns with porcelain on top. Think about all the dental work. You've got retainers that are made out of nickel. They need to look at what those options are before they put nickel in there. The idea behind the Proposition 65 is that the patients have a right to know what's going in their body. The doctors have a right to know so that they don't feel so ignorant about different things. It covers not only mercury and nickel, trust me. If you go to California, I want you to start looking around. Every hotel has these placards everywhere. That in the one hotel room we're in, and I took a picture somewhere, your pillow has feathers, and it could be a hazardous, a hazard to someone who has allergies to feathers. They have gone overboard because they're scared to death of this particular rule. So always, it's designed for something, and then somebody else is going to find a way for a lawsuit. It is interesting, in the summer of 2000, so you think about that, 19 years ago, a judge in Maryland ruled that the Maryland State Board of Dental Examiners violated the law by prohibiting dentists from discussing the risks of mercury amalgams. There's actually a big article written because it was a gag order. If you as a dentist told your patient that a mercury filling was 50% mercury and that could be toxic, you could lose your license. That's ridiculous. Now, you want to know even more than that? It is Virginia. I've got a member in Virginia. He won't take out mercury fillings at all right now. Here's what happened. Lady came to him. She wanted her mercury fillings taken out. He said, "There's nothing wrong with any of your mercury fillings. They're not broken down. They're all serviceable. Why do you want them taken out?" I just been doing my own research, and I want my mercury fillings taken out, and I want white ones put in. But I do understand there's a right way and a wrong way, and I see that you're with this group, so would you be willing to take out my fillings? I will if you will sign a waiver here that says that you understand that I'm saying there's nothing wrong with these fillings. You're doing it as a personal cosmetic choice. Yes, that's what I'm doing, personal cosmetic choice. Okay, so took out all of her fillings the correct way, put white fillings in. She just loved them. She didn't want to drive the distance to go get her teeth cleaned, so she went back to her regular dentist, who said, "Oh my gosh, look at your teeth. They look great. What physician wrote the letter for you so you could have your fillings taken out?" What? "Oh yeah, here in Virginia, you have to have a physician write a letter for you to take to a dentist that says that there's mercury poisoning for you or some reason why you have to have your mercury fillings taken out." She said, "I can't just make a personal choice for my own body. I can go get a boob job. I can get a nose job, but I can't have my fillings taken out." That's right. "Who took out your fillings?" And she told him. And so he got turned into the board. $5,000 fine and a board action. And he called me and I was livid. I said, "Let me find lawyers for you. Let's fight this." And he said, "No, I really don't need, I just need to keep my nose clean, and I'm not going to take out fillings anymore at all. I'm going to do other restorative work, but I will not take out a filling." And that's where he is. I can't believe in this United States that a citizen cannot make a personal choice for a tooth, but you can make a personal choice for a gajillion other stupid things. You can go get a tattoo across your forehead that makes you look dumb as all get out, but you can't. But you can't have a mercury filling taken out. It's just insane. So my panties are in a lot. Sorry. Okay, so nickel is a known carcinogen. It binds to oxygen and nitrogen and sulfur-containing biochemicals. So while we're talking about nitrogen, I'm going to drop. I have ADHD, so you get different information sometimes than it's on the slide. Anybody ever seen those ozone machines that you can buy online that say that you can make ozone at home with no oxygen? You ever seen them? They're all over the place. Less than $100 you can get it. You cannot make medical grade ozone unless you have oxygen, because the oxygen that we breathe has nitrogen in it, which means that you are making toxic, very toxic ozone. You hear the weatherman say, "Ozone alert, don't go outside if you've got respiratory problems," because that ozone has nitrogen in it. So how stupid would it be for someone who comes in, and trust me, I have patients that come in all the time, "Oh yeah, we've just bought a little ozone machine. All you got to do is plug it in. It makes ozone out of the atmospheric air." And I'm going, eh. But I have to explain to them why. But it's the same thing here. When you're looking at the nickel, it combines with nitrogen. It's immunosuppressive. That's my big thing with titanium implants. All titanium implants have nickel in it. All titanium implants have nickel in them. It's immunosuppressive. It means it inactivates your own body's natural killer cells, which means that now you are at risk of not being able to fight cancer. Titanium itself is a hapten. Go Google that word. HAPTEN. Hapten. What that means is that anything that is a known hapten can trigger an autoimmune. So you get an implant placed, and now you have diabetes or scleroderma or lupus or Sjogren's disease. Even if you get the implant removed, you've already pulled the trigger.
Even if you do the compatibility test.
That's different. You're okay. It means that you're not allergic to it. Doesn't mean, so if I'm not allergic to a bullet, the bullet will still kill me, right? If somebody shoots me with it, doesn't matter that I was compatible with the bullet, it still did damage. So yeah, titanium taboo. It also attacks the visual areas of the brain. So you see people having more problems with glasses and things like that. Copper, which we used to think, hey, we're gonna take out some of that mercury out of the fillings and we're gonna make them high copper. Well, that just made the mercury come out faster, so that was a dumb choice. You know, in dental school, they told you never place an amalgam next to a gold crown or opposing a gold crown. But then you had all these requisites that you had to do, and nobody ever said, oh, I can't do that because it's opposing a gold crown. It was, yeah, you need to go ahead and do that so we can get marked off your list. And so you kind of sort of forgot about that. But there was a comment, I'm sure you heard it too in dental school. Why is that? Because there's an electrogalvanic reaction that makes the mercury come out faster. And yet, even though you were told not to do it, it becomes the standard of care in dentistry. When we look at titanium, we've got 1% of the people that are allergic to it, which is not really a large part, but a lot of people have autoimmune with it. For me, here's the issue. If I have an electrical outlet and I stick a fork in the top of the electrical outlet and I bend that fork and I stick it in the bottom, what would happen to that circuit? I short it out, right? When you place titanium into a jawbone on a meridian, oftentimes it completely shorts out that meridian. And that's a different issue than it being a haften. So I can't think of any good thing for a reason why titanium would be placed and it be healthy. Okay, we are going to, it's 3:30. We're going to take another really short break, and I'm going to try to get through part of this part.